will learn about the process or mechanism of breathing, which includes mainly two steps, that is inspiration, which is also known as inhalation, and expiration, which is also known as exhalation. Inspiration begins with the contraction of the respiratory muscle, that is diaphragm and external intercostal muscle. When there is a contraction of diaphragm, the dome-shaped diaphragm becomes flat or the horizontal. So during which there is an increase in the volume of the thoracic cavity in the anterior posterior axis. Similarly, when there is a contraction of external intercostal muscle which are present between the ribs, there is a outward and upward movement of the ribs. Because of that, there is an increase in the volume of the thoracic cavity in the dorsoventral axis. So because of the contraction of diaphragm and the external intercostal muscle, there is an increase in the volume of the thoracic cavity, because of which there is a decrease in the pressure of the thoracic cavity. So when there is a decrease in the pressure of the thoracic cavity, it will be related to the intrapulmonary pressure. So there will be decrease in the intrapulmonary pressure when compared to the atmospheric pressure. So because of that, air moves from a region of high pressure region to a region of low pressure region, that is from the atmosphere into the lungs, which is nothing but the inspiration or inhalation. Next step is expiration, which is also known as exhalation, and it is done when there is a relaxation of diaphragm and the intercostal muscle. When there is a relaxation of diaphragm, the horizontal or flat diaphragm regains its original shape, that is dome shape. So when the diaphragm regains its original shape, there is a decrease in the volume of the thoracic cavity. Similarly, when there is a relaxation of intercostal muscle which are present between the ribs, there will be inward and downward movement of the ribs. Because of that, there will be decrease in the volume of the thoracic cavity even in the dorsoventral axis. So when the diaphragm and the intercostal muscle relax, there is a decrease in the volume of the thoracic cavity. In turn, there is an increase in the pressure of the thoracic cavity. So when there is an increase in the pressure of thoracic cavity, obviously there will be increase in the intrapulmonary pressure when compared to the atmospheric pressure. So because of which air moves from a region of high pressure, that is from the lung, into the low pressure region, that is to the atmosphere, which is nothing but the expiration or exhalation. So that is how exactly inspiration and the exhalation takes place.